Hello, and welcome to Nursing Research Tips, a show dedicated to sharing best practices, tips, and other resources within the areas of nursing research and evidence-based practice. I'm your host, Jenny Barrow, Associate Professor of Undergraduate Nursing, who specializes in teaching students real-world content to help transform their future nursing practice. I enjoy taking the boring world of research and EBP and making it come alive for my students, and that's what I intend to do with this podcast. On today's episode, I have some special guests from my university's undergraduate nursing research and evidence-based practice course. Omotola Adegoke, Chinazaekpere Amalu, Kanchan Balami, Aarushi Chauhan, and Madison Rogers are joining us to discuss their evidence-based practice project. Before they get started with their discussions, however, I want to let our listeners know that I have shared a copy of these students' evidence-based practice poster to accompany this podcast. You can find this link and more information in the show notes for today's episode. Now, without further delay, let's turn the show over to Kanchan to get us started.
Hi listeners, my name is Kanchan Balami, and on the behalf of my group members Omotola Adegoke, Chinazaekpere Amalu, Aarushi Chauhan, and Madison Rogers, I would like to welcome you to our podcast for Undergraduate Nursing Research and Evidence-Based Practice course at McNeese State University in Lake Charles, Louisiana. Our topic is Recurrent C. diff infection management.
Thank you for introducing your team and for sharing your project topic, Kanchan. Recurrent Clostridium difficile, or C. diff, infections present significant challenges for both patients and the healthcare system, making this an important issue to explore through an evidence-based lens. To help our listeners understand the need for this project, Kanchan, can you begin by outlining the problem your group set out to address, and why was this important for your group to examine?
Our group selected this project because C. diff continues to be one of the most challenging and recurrent infection in healthcare settings today. It is a bacterial infection that primarily affects the colon and is often triggered after antibiotic use. Antibiotics, while intended to kill the harmful bacteria, also destroys the healthy gut bacteria that help protect the intestines. When this balance is disrupted, C. diff bacteria can overgrow and produce the toxins that cause the inflammation, diarrhea, and abdominal pain. A major concern with C. diff is recurrence. Many patients experience multiple infections even after completing the treatment. These repeated episodes increase hospital stays, treatment cost, and patient complications such as dehydration, electrolyte imbalance, and sepsis. Recurrent infections also create emotional distress for the patients and families as they struggle with the condition that seems to return despite the therapy. Traditionally, C. diff has been treated with antibiotics like vancomycin or fidaxomicin. However, these medications don't always restore healthy gut flora. This has led to growing interest in fetal microbiota transplantation, or FMT, as a treatment option. FMT involves transferring stool from healthy donor into the patient's gastrointestinal tract to repopulate the beneficial bacteria and restore the balance to gut microbiome. This method helps to prevent the future reoccurrence and support overall recovery. This topic is highly relevant to the nursing practice because nurses play a key role in infection control, patient education, and symptom monitoring. Nurses are often the first to recognize the signs of reoccurrence and to educate the patients and family about the treatment options, hygiene practices, and prevention strategies. By understanding evidence-based practices, interventions like FMT, nurses can advocate for safer, more effective care and improve patient outcomes. Our project focuses on addressing the growing problem of recurrent C. diff infection by exploring innovative, evidence-based solutions that can enhance patient recovery and reduce the burden of this infection on both patient and healthcare system.
Good job, Kanchan. Thank you for outlining those important points. Your discussion highlights just how difficult recurrent C. diff can be, both because of its severe GI symptoms and because of the high likelihood of repeated infections. And all of that places patients at risk for dehydration, electrolyte disturbances, and even sepsis. As treatment approaches continue to evolve, including the growing interest in fecal microbiota transplantation, it becomes even more important to ask focused questions that guide evidence-based decision making. So, China, can you share the evidence-based practice question that your group developed and how you used it to shape your investigations?
Now that we have established the significance of this evidence-based practice topic to the nursing profession, I want to share our group's evidence-based practice question with our listeners. We crafted our evidence-based practice question in the PICO format to include population, intervention, comparison, and outcome. Our question that guided our literature search on our project topic was: in patients with recurrent Clostridium difficile infection, how effective is fecal microbiota transplantation compared to standard antibiotic therapy in achieving symptom resolution and preventing recurrence?
Thanks for sharing your group's PICO question with our listeners, China. This question served to focus your group's investigations into the published literature. Now, can you tell us more about how you used the PICO question to help you find published studies on your selected topic?
We used our group's PICO question to create keywords to search the following university library databases: CINAHL, PubMed, Academic Search Complete, Frontiers, and Science Direct databases. Some of the keywords that we used for our searches included C. difficile or C. diff and fecal microbiota transplant or FMT, and antibiotics or antibacterial or antimicrobial or antibiotic standard care or therapy, and symptom reduction or improvement or relief or resolution or outcome or resolution relapse or prevention. We set specific search limiters on our searches, including full text, peer-reviewed, published within the last 5 years, and quantitative data. It was difficult to find randomized controlled trials when we were doing our researches, but access to the library database and the search limitations we made it easier to find relevant tools to our evidence-based practice questions. The use of keywords when conducting searches helps narrow the results and make the research more focused and efficient.
I appreciate your sharing some helpful insights into your group's literature search process, Sheena. It sounds like your team faced some real challenges locating high-quality randomized controlled trials, which is common in emergent or highly specialized areas of practice. Your emphasis on refining keywords and narrowing search terms is an excellent reminder of how essential a focused strategy is when conducting an evidence-based inquiry. So now that the literature has been gathered and evaluated, let's turn to what the research actually revealed. So Omotola, can you share the key evidence your group identified?
After conducting our literature search, we carefully selected 5 high-quality studies that directly addressed our evidence-based practice question. Each study was critically appraised and then combined into a synthesis to give us a clear picture of the evidence. Let's take a closer look at the first study, Rode and colleagues, published in 2021. This study directly compared fecal microbiota transplantation, or FMT, to vancomycin, a standard antibiotic therapy, in adults with recurrent C. diff infection. What they found was pretty remarkable. Patients who received FMT had a 76% cure rate compared to only 45% in the vancomycin group. Statistically, that is almost 4 times higher odds of being cured. Even more interesting, FMT also showed a trend towards lower mortality, only 6% in the FMT group versus 23% in those treated with vancomycin. These findings are important because they highlight that FMT doesn't just stop the symptoms, it restores gut balance in a way that antibiotics alone can't. Antibiotics can clear the infection temporarily, but they also disrupt the gut microbiome, often leading to recurrence. FMT, on the other hand, helps repopulate the gut with healthy bacteria, breaking that cycle of repeated infections. Building on that, Bonewell and colleagues in 2023 took things a step further. Their study looked at over 180 patients with recurrent C. diff who received nearly 300 FMT treatment. What they found was that a single FMT resolved symptoms in about 69% of patients after 8 weeks. And when the treatment was repeated, success rates climbed to an impressive 91%. What is really interesting here is that the effectiveness of a single FMT wasn't always consistent. It ranged from 36% to 100% depending on factors like the patient's age, the specific donor used, and whether the patient received antibiotics shortly after the transplant. The takeaway is that while FMT is clearly effective overall, success can depend on individual characteristics and the quality of the donor microbiota. For our evidence-based question, this reinforces that FMT can be highly effective for preventing recurrence, especially when treatment is optimized. For example, by minimizing antibiotic use after FMT and considering repeat infusions when needed. Another study by Swenson and colleagues in 2022 looked at how the method of FMT delivery influences outcomes. They compared capsules, enemas, and rectal bacteriotherapy in over 340 patients with recurrent C. diff. They found that FMT capsules work best with only about 5% of patients having the infection come back. Enemas and rectal bacteriotherapy had higher recurrence rate. In other words, FMT, especially in capsule form, was more effective than other treatments that tried to restore gut bacteria, including some alternatives to antibiotics. This is really important for a question because it shows that FMT isn't just another option, it may actually prevent the infection from coming back better than standard therapies. Norwegian colleagues in 2024 looked at another really interesting effect of FMT, how it changes the bacteria in the gut, especially those resistant to antibiotics. They found that after FMT, patients had fewer multi-drug resistant bacteria and a lower overall load of antibiotic-resistant genes. In simple terms, FMT helps restore a healthier gut microbiome, which antibiotics alone often can't do. The researchers also noticed that these changes were not just temporary, the gut stayed more donor-like for months or even years. So FMT not only treats the infection, but also helps prevent it from coming back by creating a healthier gut environment. Finally, our last key piece of evidence. In 2024, Same and colleagues looked at FMT in a small group of children with chronic kidney disease who had recurrent C. diff. And even though this was a very specific group, the results were clear. All patients' infections resolved after FMT, and there were no serious side effects. One child needed a second treatment, but overall, it was very effective. While the gut bacteria didn't fully return to a normal state, this study shows that FMT works even in vulnerable population, reinforcing the idea that it can be a reliable alternative to antibiotics for recurrent infections.
Thank you for highlighting those findings, Omotola. Your comparison of fecal microbiota transplantation and vancomycin really underscores how complex recurrent C. diff management can be. The evidence you described, especially the improved outcomes with repeated FMT and the influence of both patient-specific and donor-specific factors, shows that treatment suggest is rarely a one-size-fits-all thing, and this does require thoughtful clinical judgment. With those considerations in mind, it's important to look at how this evidence translates into everyday nursing care. With that in mind, Aarushi, can you share the nursing practice implications your group identified based on the findings that you've previously discussed?
Based on our group review of the literature, we identified several important implications for nursing practice related to the managing recurrent C. diff infection through fecal microbacteria transplantation or FMT. First, nurses play a key role in assessing both patient and potential stool donors. Factors such as age, prior antibiotic exposure, or existing comorbidities can all influence the success of FMT. By being aware of these variables, nurses can help to ensure that appropriate candidates are selected for treatment and that potential risks are minimized. Another major implication involves patient and family education. Record the idea of fecal transplantation can sound uncomfortable or even intimidating. It's essential that nurses clearly explain the purpose of FMT, how the procedure works, and what kind of aftercare is expected. Education can also help to reduce fear, improve adherence to post treatment recommendation, and encourage timely follow up care. Our research also highlights the importance of collaboration across the interdisciplinary team. Safe donor screening, infection control, ongoing monitoring for complication require coordination among physicians, nurses, microbiologists, and infection prevention specialists. Lastly, we found strong evidence supporting the need of advocacy. Nurses can advocate for wider access to FMT by encouraging institutions to develop standardized protocol and equitable availability for patients who could benefit from the therapy. Overall, nurses have central role not only in clinical implementation but also in ensuring that FMT is performed safely, ethically, and effectively to reduce reoccurrence and improve the patient outcome.
Aarushi, thanks so much for outlining those practice considerations. Your emphasis on carefully screening factors like age, comorbidities, and previous antibiotic use highlights the individualized nature of FMT candidacy. You also made an excellent point about nursing education and the need for it. Helping patients and families understand the purpose, safety, and the rationale behind FMT is essential, especially given how unfamiliar and uncomfortable this concept might sound initially. Now, building on those clinical insights, your group also examined whether additional study is needed in this area. Aarushi, let's turn back to you. Can you walk us through the research implications your team identified for future investigations?
While the evidence supporting FMT for recurrent C. diff infection is promising, our review also identified several areas where additional research is needed. One of the biggest gaps involves the need of standardized nursing protocols. Many studies used different procedures for stool preparation, delivery method, and follow-up assessment, which make it difficult to compare results. Developing consistent nursing guidelines for administering and monitoring FMT would strengthen both the evidence base and clinical safety. Another key area for future research is long-term outcomes and self-monitoring models. Most current studies focus on short-term symptom resolution, but we still don't know enough about the long-term sustainability of microbacterial restoration or the patient quality of the life over time. Nurses could play a role in creating and testing patient follow-up tools that track symptoms, nutrition, and recurrence prevention. Additionally, there is a need for larger multi-center clinical trial, especially in pediatric and immunocompromised population. These groups are often underrepresented in current studies, yet they are highly vulnerable to recurrent infection. More research on safe dosing, psychosocial factor, and outcomes in these populations would help expand access to effective treatment. In summary, advancing nursing research on FMT means focusing on standardization, long-term patient outcome, and inclusive study population. By addressing these gaps, future research can help nurses provide evidence-based care that improve recovery and reduces the burden of recurrent C. diff infection.
Okay, so your group has given us a lot of excellent information about the current state of the science surrounding your selected clinical practice topic. After all the research studies your group reviewed, including considerations for study weaknesses and those continued gaps in the present literature, what was your group's overall literature-based answer to that original PICO question?
After reviewing multiple studies related to our PICO question, in patients with recurrent C. difficile infection, how effective is fecal microbiota transplantation compared to standard antibiotic therapy in achieving symptom resolution and preventing reoccurrence? Well, our group found strong evidence supporting fecal microbiota transplantation, or FMT for short, as the more effective treatment option. Across the literature, FMT consistently achieves higher clinical cure rates and significantly lower reoccurrence rates compared to standard antibiotic therapies. In other words, patients who received FMT were more likely to experience full symptom resolution and were less likely to have their C. difficile infection return. In addition to improved cure and reoccurrence outcomes, FMT was shown to restore healthy gut microbiota diversity and reduce antimicrobial resistance, which are important long-term benefits. These findings suggest that FMT not only treats the infection more effectively, but also addresses the underlying imbalances that allow recurrent infections to occur. The research also supports the overall safety of FMT, with most studies reporting minimal side effects and long-term symptom controls. However, it's important to note that standardization of donor screening and administration methods continue to be refined to ensure safety and consistency across healthcare settings. Overall, our conclusion is that FMT demonstrates greater effectiveness compared with standard antibiotic therapy for treating recurrent C. difficile infections. As future nurses, we can apply what we've learned by understanding the importance of evidence-based practice and staying current with evolving treatments like FMT. This knowledge can help us educate patients, advocate for effective interventions, and contribute to infection control efforts to improve patient outcomes.
Thank you for summarizing your group's conclusions so clearly, Madison. The evidence you reviewed presents a compelling case for fecal microbiota transplantation as a more effective option for managing recurrent C. diff infections, with higher rates of symptom resolution and significantly fewer recurrences compared to traditional antibiotic therapies. Your note about ongoing efforts to standardize donor screening and selection also highlights how quickly this field continues to evolve as researchers work to optimize both safety and outcomes. I appreciate your group's reflection on the broader lesson that this project reinforced. Staying up to date with emerging scientific evidence is essential if we want to be effective client advocates. As future registered nurses, your ability to interpret new findings, question existing practices, and support patients through complex treatment decisions will make a meaningful difference in the care that you provide. Thank you to all of our listeners for listening, for joining us, and for investing in conversations that move nursing practice forward. When we stay engaged with the evidence, we strengthen the care we deliver and the profession we represent. I hope you'll join us again on Nursing Research Tips in the future.